Hi, and thanks for listening. In my presentation today, I'd like to tell you about the burden of Alzheimer's disease and the disproportionate costs placed on family caretakers, as well as possible policy options to reduce this burden. Alzheimer's disease, AD, affects an increasing number of individuals and is creating an enormous strain on the healthcare system. In 2022, an estimated 6.2 million Americans will be living with AD, and this number is projected to explode to over 12.7 million by 2050. Family caregivers of people with AD are often referred to as the invisible second patient and routinely suffer higher rates of social isolation, physical ill health, and financial hardship. The policies considered seek to provide financial relief, improve caretaker skills, and ensure emotional support for family caretakers. The eightfold path was used in developing these policies with consideration for the legality, political acceptability, administrative robustness, improvability, and sustainability. People living with dementia tend to want to stay in their homes and retain as much independence as possible. 83% of the care provided to older adults in the US comes from family members, friends, or other unpaid caregivers. In 2020, family members or unpaid caregivers provided $272 billion of care for 80 patients. The estimated cost overall for AD in 2020 was over $305 billion, with the expectation that this will increase to more than $1 trillion by 2050. These costs also come with significant negative social and personal burdens. An estimated 1.81 million in federal dollars will be spent through Medicare, representing 1 in every 5 Medicare dollars being spent on this disease. The fiscal advantages of keeping AD patients at home are as compelling as the emotional benefits. The graph here depicts a difference in duration, 6 months in Europe versus 36 months in the US, although sometimes much longer, of average long-term residential care. The financial ramifications are significant, with Europeans averaging $30,000 compared to $180,000 in the US. This study credited Europe's robust home care education system, supportive policies in providing in-home assistance for this reduction. Unlike the US, the European model for long-term care is an integrated palliative care approach for focusing on end-of-life care only. Policy recommendations include modifying taxes and reviewing the possibilities for reducing the financial strain experienced by caretakers. Different tax model and predictive models of change and credits were considered. The following 3 changes were combined to create one model that sufficed the needs of those who suffered the most financially. Number 1, currently, you are only able to declare an elderly relative as a dependent if they are receiving less than $4,300 annually, including Social Security. The average Social Security payment for those 65 and older is over $1,500 a month. The ceiling should be raised to at least $19,000, allowing caregivers to use this income for care while also declaring the elder as a dependent. Number 2, increase the elder caregiving tax credit. Currently, you can claim up to $8,000 per elder, but for a family with 2 children and 1 elder who makes $50,000 annually, this family's tax refund would be $2,000, hardly enough to care for an elder. Increasing the credit would help boost returns and aid in offsetting care costs. Number 3, allow the caregivers to declare the maximum child care credit for the elder. Currently, this is $3,600 per child, but only available for children dependents. Secondly, we need to increase training and support. 3 categories in expanding training and support services were combined in an effort to provide better education and support for both healthcare professionals and family caregivers of AD patients. Number 1, expand training and support services for unpaid caregivers and other family members. Number 2, train more in-home healthcare workers, both entry-level and professional providers, to provide both in-home care as well as deliver caretaker education in the home. And number 3, increase training and workforce development. Pre-service and in-service training standards for certification and meeting best practices need to be standardized. Currently, these standards vary widely across the country. In conclusion, we can ease the burden of Alzheimer's disease by providing support and financial relief to AD caretakers who should be incented to keep parents in home for as long as it's realistically possible to do so. The policies outlined would provide choices guided by the incentive of saving over $60,000 annually by delaying long-term care. Socially, these policies seek to increase social acceptance and empathy in caring for elders. If made available, this model could offer an alternative to long care options that ultimately benefit both patients and family members, as well as relieve some of the financial and social burden that AD places on the society. Thank you very much for taking time to listen to my policy today.